Hello, guys. So let's study about hepatitis D. The etiology of hepatitis D is obviously the hepatitis D virus, which is a delta virus. It is defective or incomplete RNA virus. So, why is it known as a defective virus? Because it cannot cause infection on its own. It requires hepatitis B for causing infection. It belongs to Delta Viridae family. It is covered by an outer coat that is shell of HBsAg, which is hepatitis B virus a surface antigen. It will be covered by that, so therefore it cannot have independent existence and requires hepatitis B virus for its replication and expression. The duration of hepatitis D virus is dependent on the duration of hepatitis B virus, so it can occur either via co-infection or superinfection. So co-infection means that a hepatitis D virus is exposed simultaneously to serum containing both hepatitis B virus and hepatitis D virus. So once a person is exposed simultaneously to both hepatitis B and D virus, then what will happen is first the hepatitis B virus will get established and HBsAg will be formed. After that, there will be development of HDV virion, this is hepatitis D virion. Superinfection refers to infection with hepatitis D in an individual who already is having chronic hepatitis B infection. So, if an individual is already having chronic hepatitis B infection, will now be exposed to hepatitis D infection and will develop hepatitis D infection that is known as superinfection. The mode of spread will be either via parenteral route and sexual contact. The fulminant hepatitis it occurs most commonly after co-infection than superinfection. The clinical features in hepatitis D are same as that of hepatitis A. So the clinical features will include having an incubation period which will depend upon the hepatitis B virus. It will have a pre-icteric phase, that is before the onset of jaundice, that is 1 to 2 weeks before the onset of jaundice. The patient will have nausea, vomiting, poor appetite, fatigue, malaise, headache, and anorexia, which are non-specific findings. After which there will be a low-grade fever, which is generally not seen much in hepatitis D. It is more common in hepatitis A and E. There will be vague upper abdominal pain, and in phase 3 will occur symptomatic icteric phase where there will be icterus, that is clinical jaundice will be present and prodromal symptoms will diminish. There will be dark urine and pale stool. The liver will be enlarged and tender. Phase 4 will be recovery where the symptoms will disappear. There may also be extrahepatic manifestations seen in hepatitis D virus because it is more common in hepatitis B virus, and hepatitis D virus occurs only in the presence of hepatitis B virus. The investigations include serological markers, which will be hepatitis D virus RNA, which will occur before and in early days of acute disease. It is seen in blood and liver. Anti-hepatitis D virus will have IgM antibodies and IgG antibodies. So IgM antibodies will occur after recent hepatitis D virus infection, whereas RNA will occur in before the onset of clinical illness, before the onset of clinical symptoms, and in early days of acute disease there will be hepatitis D RNA. The other investigations of hepatitis D is similar to that of hepatitis A virus, so which will include urine investigations. There will be bilirubinuria in early stages and increased urinary urobilinogen. The hematological findings will include increased ESR, leukopenia, relative lymphocytosis, prolonged prothrombin time, which is one of the best indices of prognosis. The biochemical investigations include serum aminotransferase such as AST and ALT, both will be elevated, but ALT will be more than AST until there is cirrhosis, where there will be AST will be more than ALT. The bilirubin will be increased, which is both conjugated and unconjugated bilirubin will increase equally. The ALP may be increased, the serum protein will be normal, and blood glucose may be low. The treatment until we have to treat the hepatitis B infection, along with that also the D infection, which will have certain drugs such as pegylated interferon alpha and adifovir, which we have to use for about a period of 12 months. This is all about hepatitis D virus. Thank you.